All right, so of course, my little disclaimer that I give at the beginning, this document is for educational and instructional purposes only. I do not claim full rights to this material. Most of the questions are modified from previously constructed questions acquired from various online resources. Simply put, I don't claim that I constructed these questions by myself or these are my original content. I just get the questions offline. I try to reconstruct them so they don't be a replica of, other people's questions or what you've already seen. My primary goal is to just help y'all understand how to answer these questions to pass the test, not to, take credit for questions or anything, because I'm not that great. So we're gonna get started. I'm gonna start off reading, and hopefully throughout the session, y'all can jump in and read some and answer some as well. All right. So we're gonna start off with a first question. So for you, Ms. Yolanda, this is considered a clinical intervention. The minute I see a first question, I already know they're asking me to intervene. If I see first and next, that's clinical intervention. That's unit 3. So an elderly woman has been hospitalized for treatment of a stroke. The physician recommends placement in a rehabilitation facility and refers the woman and her family to the social worker. The daughter wants her mother to come home since she would like to continue caring for her, but the family is concerned about her being able to provide the necessary care. The social worker should first. All right, so right out the gate, before we run down to the question, to the answer choices, we want to, kind of break down what's going on in the scenario. And we start that by just reading and understanding what's happening. So we know we got this woman that's hospitalized for a stroke, and the physician want her to go to a rehab facility, but the daughter want her to come home. So can anybody identify where we are in the helping process? Because that's the first thing you need to do when you get these clinical intervention questions. When they want you to intervene, then you got to know where you at in the process, in the helping process, so you can know where you need to intervene at. So in the helping process is up here, beginning, middle, or end. So where do you feel like we are? Anybody can just, blurt it out. Do y'all feel like we're in the beginning, the middle, or the end of this process according to this situation that they gave us?
The beginning.
Okay, tell me why we're in the beginning.
Because it says the first. What should she do first? So they just met.
Okay, so, I'm glad you answered that. Just because it says first, that does not mean you're in the beginning. First, just denotes. I'm gonna say it again.
Are they in the end? Because it looks like they're trying to come up with a discharge.
Possibly. That's good. That's a good observation. So let me explain this first, Ms. Yolanda. When you see first, that does not necessarily mean that you're in the beginning just because it says first. First only means that how they want you to prioritize your intervention. So when it says the social worker should first, that means they're just asking you, what should you do first? How should you intervene first? What is the priority intervention? What is the most important thing you should do? It doesn't mean where you are in the process. Now, the importance of knowing where you are in the helping process, y'all, is because it means that that's where your answer, you're going to have to do something that is for that phase of the process that you're in. So if you are in the beginning, and according to this, so I had somebody say that we're at the end, somebody say we're at the beginning. Ms. Bridget, what you think? I'm just curious.
I believe that we're in the beginning phase.
Tell me why.
I chose the beginning because it says the physician recommends placement in a rehabilitation facility and refers the woman and her family to the social worker. So I just went refers.
Okay, so you went off one word. Okay, so before we clear that one up, tell me what the presenting problem is then.
Okay.
What is the presenting priority issue? Anybody?
Okay.
Placement.
The daughter wants the daughter wants her to come home.
Right.
So okay, so Rochelle, you're saying place. Wait, okay, so Rochelle, are you saying the recommends placement, or are you saying?
Well, I'm meaning like where the woman is gonna go once.
Okay, I'm glad we cleared it up. So whenever I ask for the priority presenting issue, I want you to tell me verbatim from the scenario. Just like read it to me, or say, like, for instance, like I don't remember. I think it was Ms. Yolanda said the daughter wants her mother. identify it verbatim from the scenario. Like, don't try to
Okay.
summarize it in your own words, because that's how we start, like, assuming and making up stuff. So instead of doing that, let's just go verbatim. So now,
Okay.
I will tell y'all, since we have identified the presenting problem, we are in the ending process, y'all. So Rochelle, you were correct about that. We were in the ending phase of this part of the helping process, because it's telling you that the daughter wants her mother to come home. So she has been hospitalized. That already happened, and now she's getting ready to be released. So that means we're at a phase where we're trying to review the progress and see what we need to do next or terminate. So we are in the end of this situation, okay? I want y'all to look at it like that. So usually when we're in the end, we're focusing on what are we doing next. We're evaluating where we currently are and what are we going to do next. Are we going to terminate? Are we going to refer for services or continue treatment or whatever it is? We're just evaluating where we are next. So now we know that our priority problem here is the daughter wants her mother to come home since she would like to care for her. Y'all, let me tell y'all a secret. I don't know if it's a secret, but one of the primary things that I found out, if you want to identify a presenting problem, it normally comes after the word but. So if y'all want to note that, I can tell you it's almost always, I'm not an absolute person, so I'm not going to say always, but I can tell you almost always the problem is going to come after the word but. So here it is, his daughter wants her mama home, but the family is concerned about her being able to provide necessary care. So what is the most important thing that you should do in this situation as a social worker to clinically intervene? What is the most important thing we need to do? So let's go through the answer choices one by one. Just to recap, because I want to make sure y'all understanding, y'all looking at it exactly how it needs to be. So this woman has been hospitalized. It's time for her to, kind of, I guess, transition from the hospitalization. The physician wants her to go to a rehab facility. The daughter wants her to come home. The family like, nah, the daughter can't even take care of her. So that's the problem. So the most important thing we need to do is reassure the daughter that the facility can provide better care. Is that the most important thing that we need to do about this problem that's going to directly address it?
No.
No.
All right, so everybody in agreement with that? I don't need to explain. What about B? Is the most important thing we need to do is to consult with the mother and family members regarding placement. Pause or scratch. I forgot to say that in the beginning. We're either pausing if it could be the answer or scratching if it's absolutely not the answer. If anybody says scratch, we got to keep it. I mean, pause, we got to keep it.
Pause
Let's
it.
say pause.
Okay. All right, everybody on one accord so far. All right, so what about C? Refer the daughter to her mother's physician to discuss the placement.
Scratch.
Scratch it.
Scratch. And what about D? Suggest the daughter take a tour of the rehabilitation facility.
Scratch.
Pause.
Scratch.
Okay, so we got to pause. All right, so for the person who paused, I think it was you, Rochelle.
Mhm.
Why do you want to pause? Since you said pause, we got to get the rationale of why you want to pause.
Well, okay, so the daughter wants to take her mother home, so she can care for her. I don't think it would be a bad idea for the daughter to be able to, walk through a rehabilitation facility just to kind of see what she's up against if her mother were to come home.
Okay. Okay. So one thing I want y'all to focus on when y'all picking these answers to focus, make sure you're focusing on the presenting problem. So the daughter wants her mother to come home, but the family's concerned about her being able to provide the necessary care. So is suggesting that the daughter take a tour of this rehabilitation facility going to address the fact that the family is concerned that the daughter can't provide necessary care? I'm not saying that it's right or wrong. I just want y'all to think on that level. So is D going to address what we said our priority issue was? The family being concerned about her being able to provide the necessary care.
No.
Actually, no.
No.
Okay, so Rochelle has now said no, so I'm gonna scratch it out since everybody's saying no. And y'all, it's okay right now, especially to change your mind, because I want y'all to be looking at it like y'all need to look at it. So that means the only thing we have left is B. So are y'all telling me that B is the answer, that the best way to address the family's concern is to consult with the mother and the family members regarding placement.
I would say yes, because it
Yes.
addresses both parties.
Right.
I'm sorry, everybody. So everybody said yes.
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 All right. Well, everybody is right. So I want to know, what are y'all thoughts about this question? So far, just being able to look at it from the aspect of doing the most important thing that addresses what y'all identified as a presenting problem.
But
Does
this
it
one,
is it clear, or anybody have any questions on how that happened?
I understand why the answer is B, but in the beginning I got it wrong. Not, because I said we were in the beginning phase. And can you tell me why you said we're in the end phase again, please?
Because she has already been hospitalized, which is
Okay.
past tense, and she's getting
Okay.
ready to transition out. They're trying to transition her out. So that pretty much means they're trying to terminate her from one stage and bring her into another phase. And that
Okay.
phase could possibly be terminating her completely from the medical care and sending her home, or terminating her to the facility. So it's just really the issue. I mean, not the issue. I guess the highlight here is the fact that, she has been hospitalized and she's getting ready to leave the hospital. And when clients leave hospitals, we would normally refer them somewhere, or we have to have a plan of care for them to leave when they leave. So that's all this is okay, what are the next steps? What are we going to do next now that she's being terminated from the hospital?
Okay.
So that's kind of why it's terminated. All right. Any other questions about that? Rochelle, you do now have the understanding why D, which is not a bad option. It's not a bad suggestion, but you do understand why it's not the priority answer, because we're looking for the most important answer.
I do understand.
Okay, and so the other thing before we move on is that usually you want to find an answer, y'all, and y'all look how this is. I'm about to mess up. Let me undo this. But usually, y'all, the answer is in direct relation to the presenting problem. So all you have to do, even if you're stuck, is go back and line that back up and say, okay, what is it addressing? Like, okay, so for instance, the daughter wants the mother, whatever, the family is concerned. So we're looking at a family that's concerned about the mother and where she's gonna be. So the only answer that addresses all of that is consulting the mother and all the family members.
Mm-hmm.
So just make sure it matches up directly. Miss Naomi, I seen you came in. You okay? Everything good? Okay. Well, we're gonna continue on.
so I have a question real quick. So you
Okay.
said that, so when we see the word but, the but means to address the but concern, but is concerned about being, so we should.
I'm saying, and this is Kim saying that normally when it says but, that's where your problem lies. Now, don't just always see a but and be like, oh, that's presenting problem. Make sure it makes sense. But I can tell you, most all the questions that I've had experience with, whenever it says such and such and such, but whatever follows the but is where your primary issue, where your priority issue lies, and that's where you need to be focusing your intervention on, because that's where your problem is. Because see, it's not a problem that the daughter wants to take her mother home to care for. That's not a problem. Since when that's a problem? The problem is the family's like, oh, we don't know about that. That's what makes it a problem. Make sense?
Yes.
Okay. So that's just a little something that I kind of found out on my, something that I figured out. Like every time I see a but, I'm like, okay, every time I identify the presenting problem and it has but, the whatever follows that but is normally presenting problem. And I promise y'all, it's been consistent. So I feel confident in telling y'all that. So this is an assessment diagnosis or a unit 2 question. A social worker has been seeing a client for 4 months who reports that she broke up with her boyfriend over a month ago after a violent fight during which he tried to kill her. The client reports having nightmares and continually feeling on edge. She has often missed classes because she loses track of time and is sometimes afraid to walk across campus. The client's most likely diagnosis is. All right, so before we even look at those diagnoses, whenever you identify, they're asking you about some symptoms, or they ask you, well, if they ask you about a diagnosis, the primary thing you want to focus on is symptoms. So you look in there and you go and you highlight all these symptoms, and that's what we're gonna focus at, because that's the type of question this is. It's asking you what is the client's most likely diagnosis. So in this one, you don't need to determine a phase of a process. You can, but I can tell you it's not relevant to these type of questions. So knowing and being able to identify the type of question you're answering, unit 1, unit 2, unit 3, unit 4, that is also going to help you answer these questions quicker, because sometimes it's going to save you work. So if you sit here and you try to, what phase am I in, all of that, you can do that, but it's not relevant. Okay, so they're asking you for a diagnosis. A diagnosis of what? These symptoms. So can y'all point out to me what symptoms that we need to be paying attention to?
Nightmares and continually feeling on edge.
Okay. Any other symptoms?
Track of time, afraid to walk.
All right. So because they're asking me for a diagnosis, I'm paying attention to, okay, so which one of these diagnoses is going to be related to these symptoms? So you have a client that's having nightmares. She continually feeling on the edge. She losing track of time. She afraid to walk across her school campus. So just keeping that in mind.
And we
All right.
also, I'm sorry, I was just gonna say, we also need to pay attention to the duration as well.
Yes. You remember, I see you come to group. So yes, so you have to, so you know the symptoms. That's the second. So first off, you see the symptoms. Now you need to figure out, you need to see, do they tell me how long it's been going on? Like how long has this been going on? Because that makes a difference in these diagnoses, y'all. And that's what the ASWB exam want to know, that you know the difference in duration, because acute disorder, acute stress disorder, and PTSD and all of that, the only difference that separates them is the duration. So that's why we need to know that. So in this case, it tells you that, the social worker been seeing her for 4 months, and she broke up with her boyfriend over a month ago. So she been out this relationship over a month ago. And after they had a violent fight, and he tried to kill her. So this is one of those, we make sure we keep the situation in mind. So she didn't have a traumatic event. After this traumatic event, she gives these symptoms. What is the most likely diagnosis? Is it a acute stress disorder?
I would say no.
Anybody want to
Possibly.
pause that one?
I want to pause that one.
Okay. What about nightmare disorder?
Scratch it.
What is nightmare disorder, y'all? Y'all heard of it? I never heard of it. I probably made that up on here. Adjustment disorder. Is this the symptoms for adjustment disorder? She had a traumatic event and she's doing all this traumatic stuff up here. Is she most likely having an issue with adjustment?
I wouldn't think so.
All right. What about PTSD?
Pause it.
All right. So I just said a minute ago, and I didn't realize I was talking the answer pretty much, but the difference in between these two, y'all, is the duration of the symptoms, or how long it's been going on, the events that took place prior to the symptoms. So A or D?
D.
Somebody said D?
I think somebody did say D.
Okay, are you agreeing or disagreeing?
I'm kind of stuck on it. It could be either A or D, but I kind of want to go with A.
Okay. So this one's gonna be real quick, y'all, because this is one of those, if you don't know, you need to know type of question. This is like, it's recall. And a little bit, because you have to know the symptoms and durations for the most common diagnosis. And acute stress disorder is one of the common diagnoses you most likely will see on your exam, as well as PTSD. And so the answer for this one is D. I keep doing this. PTSD. And I'm gonna let y'all read I'll read the rationale because it'll explain a little bit better than me. So the seriousness of the precipitating event. So because a month ago she had a violent fight in which he tried to kill her, that is trauma. I kept saying, you know, she experienced some trauma. So acute stress disorder, that's like when you have this event that happens and it kind of stresses you out, but it's only short term and it's not as long as PTSD. And it's not always associated with trauma. So in this situation, it told you that she'd been through some trauma, and all of these are trauma symptoms: nightmares, feeling on edge, losing track of time, all of that. So PTSD is definitely the answer. So this one right here, Rochelle, this is just a matter of kind of knowing the difference between these disorders. Not really breaking down, but at the same time, if you're paying attention to the symptoms, I like to pull out what those symptoms are, and then say, okay, these are symptoms, how long she had them or why she got them. And that's how I go to the disorder or to the diagnosis, but you have to know those diagnoses. And I keep saying I'm going to do a list of common ones. I think I do have it in my course, but there are just a small list of common diagnoses that will be on these exams. All those diagnoses are not on there, but like bipolar 1 and 2, those are on there. Acute stress disorder, PTSD, adjustment disorder, those are the common. Schizophrenia, anxiety and depression. All that other stuff, y'all probably won't see that. So y'all, for those who want to go and study all the diagnoses in the book, like in the DSM-5, don't waste your time, because even when you do get one of these questions, it's probably going to be like 2 or 3. So, and it's just the main ones that people are really getting diagnosed with every day, and ADHD with kids. All right, so now we got our best question. A social worker is employed as a case manager at a mental health community clinic. The clinic has recently become short-staffed, which has resulted in the social worker's caseload dramatically increasing. What is the best way for the social worker to respond? So when you hear best, normally if it's in regards to a client, you want to meet them where they are. When in this case, it's not really in regards to a client, it's in regards to the social worker. So you want to do, you know, what's best for the social worker. Okay. And so best is just, I tell people all the time, most and best is just what it says. What makes the most sense, or what is the best thing to do? What benefits the client most? Or in this case, what is the most beneficial? So you can think of best as most beneficial. So what is the most beneficial way for the social worker to respond in this situation? What is the issue in this situation?
The clinic has recently become short-staffed, which has resulted in the social worker's caseload dramatically increasing.
Mm-hmm. Okay, so now we just need, all the question is asking us is just put yourself in them shoes. Every question on this exam, y'all go live. Just say, man, if that was me, I'm at this clinic and we became short-staffed. Rochelle, we know all about that. And our caseload is swamping us. What is the best way, the most beneficial way for you to respond? What is the most ethical way for you to respond? All of that, what's going to benefit you the most? Okay, is it to space out the client sessions to ensure that everyone can be seen? Is that the most beneficial and ethical thing that we can do? Pause and scratch.
Scratch.
All right. What about B? Advocate for a smaller caseload to better manage her cases. Is that the most beneficial and ethical thing that she could do? Pause and scratch.
Scratch.
Yeah, scratch.
Okay. What about C?
Pause.
Pause.
Okay. And what about D?
Scratch.
Pause.
All right. So tell me why we scratched A.
Why we scratch what?
A. Why are we not spacing out the clients to ensure everyone can get seen? Why do we get rid of that?
Because it's, well, with me, it says the best way, and the best way is to prioritize.
Mhm.
Like, what is
Okay.
spacing out?
Okay, so why won't we advocate for a smaller caseload?
Because that's
Because
like saying lesser clients.
Okay. What you was gonna say, Rochelle?
the clinic is short staffed. So if you were to, get a smaller caseload, who's gonna be there to see the,
Ooh, this is gonna be good. See, that's why we be in the situations we in. What about D? Do her best,
D?
even if it means working a few extra hours until the clinic can employ more staff.
We gonna work
ethically, I
with
think
them.
that would be the right one.
Ethically?
Well, I think that maybe not ethically, but I don't know. I'm stuck between C and D because
Okay. So we stuck between C and D. So everybody else is saying C. Am I clear?
I don't prioritize the most critical cases, like, so we just don't see the other people.
Yeah, that's what it's saying. Because see, I heard somebody say, oh, somebody just got stuck on one word, and y'all know in groups I don't let y'all get stuck on one word. So somebody is focused on just because it says prioritize, but it has a whole 1,
Yeah,
2, 3, 4, 5 more words after that. So
Yeah.
what is it? What do we really prioritize? And what does that mean? Somebody
probably
just said
every
it.
case is critical.
I mean, yeah, we prioritize the most critical cases for appointments. That means we are not serving our, we're basically picking and choosing who we want to serve.
right.
And that's not fair because, who deems what's more critical? Everybody who come in our clinics, their situation is critical. Everybody got a fire. So if you be like, oh, well, I'm only gonna see Susie, Joe, and Billy because they got all this going on. I'm not gonna see her because that ain't really that important. She can wait for that. Like, you see how that sounds or looks? That doesn't sound ethical. So I'm gonna tell y'all C, not the answer. So Rochelle, you were saying D, but is there any other one that we want to? Or Rochelle said D. I shouldn't have scratched it out. Is there any other one that we want to look at as well?
I would pause B.
Okay. All right. So now we got B and D. Let's talk about it. I want y'all to talk about it because I want y'all to get in the habit of thinking these questions through without me I don't want to tell y'all. So let me just paint the picture. We live. You're stressed out because your clinic is short-staffed. Is that your issue? Rochelle, is it your fault that your job is short-staffed?
No, and
will it benefit you to work
we would
extra
love-
hours? Go ahead.
we would love to advocate for smaller caseloads. However, the best way, to ensure that these people are getting the care that they need, there's going to be multiple people left out if the employees left there.
So if you burn out, how you gonna help them clients? Working all them hours, how you gonna be helping them clients all burn out?
Well, I'm assuming.
And what if it take a year for them to 2 years for them to hire more staff?
Well, it's, even if it means working a few hours, but what she can do is do her best.
Okay.
Because we can advocate all day long, but I don't see, what is
the question? What is the question asking y'all?
The clinic, what is the best way for the social worker to respond?
So usually when I see respond, to me, they're looking for an answer from the social worker. So I just chose, I would advocate for smaller caseloads. Okay.
So in this case, I kind of drug this one out intentionally because this has a lot to do with ethics, y'all. And one of the things, I don't know if y'all seen the new updated code of ethics, but one of the main two things that they updated in the code of ethics is personal self-care, as well as a lot of this stuff that's dealing with technology, since a lot of us are doing teletherapy and stuff now. But emphasis on self-care. Like, we can't be letting these jobs burn us out. It is not our responsibility or obligation to work ourselves to death because the jobs are short staffed. Now, granted, I get 1,000% what you're saying, Rochelle. Yeah, we can help out a few extra hours here and there or whatever. But that's our choice. Like that, we don't want that to be the go-to thing, because again, it says until the clinic can employ more staff. We don't know when that's gonna be, when that's going. So you mean tell me you're gonna work a few extra hours, burning yourself out for a whole nother year if they can't find new staff? Yes, it's always good to help out when you can or whatever. Not saying that's not what you're supposed to do, but the answer is B, and here is the why. Okay. The NASW is clear that social workers should not have caseloads, y'all. This is directly in the code of ethics. So if you ain't read it, go read it, or you can go listen to my video on YouTube that I just made with the whole code of ethics. It's so large that they're unable to provide service of high quality clients. So it's kind of like you got this big old caseload. You gonna either be, like you said, picking and choosing who you want to see, or when these people are supposed to get, let's just say 45-minute sessions, now they getting 15-minute sessions because you got over, and that's not helping the client. In our role as social workers, the most ethical thing for the clients is to, you know, advocate for smaller caseloads. They just don't have to figure it out. Stop doing a intake freeze or whatever they got to do. But the question is asking, what is the best way for the social worker to respond? This is about the social worker, okay? A social worker is employed at a case as a case manager. So this is about you. So the most beneficial thing that you can do for yourself is advocate for a smaller caseload. Now that's not saying that
I didn't pick up on that it was mainly for the social worker.
Yep, that's why I asked what the question is asking. What is the question asking? And that's how I want y'all to look at. You got to look at all the little details in the question, because it is about, I know most of the questions is about clients, but this question was not about clients. This question was, what is the most beneficial thing? What is the best thing for the social worker? And I'm gonna advocate for y'all to take some of these clients off of me, because no.
So I have a question. So since you said that they just updated the code of ethics, so will this, like, the updated version be like?
Oh, well, when I say just, this, I say that was 2021. So the last update that I know of is 2021, and yes, it's being reflected already in here. Self-care is already, it's probably not going to be like a million questions on the exam about self-care, but it's already on there, as well as you're going to start seeing more questions revolving around technology.
Okay.
So the last update before this one was in 2017, but especially after the pandemic, they updated it in 2021 for all that technology stuff. I actually think the self-care was updated. That part might have been in 2017. No, it was 2021 too. So yeah, so you'll definitely start seeing it. I don't know, you know, how they change the exams or anything like that, but definitely whatever is currently going on in the world that, you know, social workers have to deal with, that's what they put on the exam. All right, so moving right along. We got a next question. This should be good. Anybody want to take this one?
I'll take it.
Go ahead.
Okay.
You can go ahead if you want to.
Go ahead, Rochelle.
Okay. A social worker is in an intake interview with a client who states that she would like to work on being more confident at work. The social worker has already completed the assessment. In order to best assist the client, what should the social worker do next?
Stop. What phase of the process? When I see next, it already tells me, Ms. Yolanda, I'm clinically intervening. I'm gonna keep reminding you that it's the next question. That's the clinical intervention question. So, Rochelle, what phase of the helping process are we in? Are we in the beginning, middle, or end? And when I say that, Rochelle, that just means the helping process up here, engaging, assessing, all that stuff. I broke it down into 3 phases. So in the beginning, we're engaging and or assessing, middle, planning, intervention, and evaluating, termination. So according to this scenario, are we in the beginning, the middle, or the end phase of the helping process?
The middle.
Why is that?
Well, she's already completed the assessment.
That's really, really good. That's really good, because a lot of people see this, and that's why I wanted to put this one here, because you are in an intake interview, which is in the beginning, but then they tell you here, oh, but she's already completed the intake. So that's a very good observation. All right, so what is the problem here? What is the priority issue that we need to be working on?
She wants to be more confident at work is the presenting problem.
Yep. right, and what is the question asking of you to do?
In order to assist the client, what should the social worker do next?
So in order to best assist the client, this is probably my favorite term on the exam. And when it say in order to best assist the client, that means meet them right where they are, even before you go to this next part. If it tells you in order to best meet the client, that means you're gonna meet them where they are and you're gonna do what's most beneficial for them. Okay, so what should the client do next? I mean, should the social worker do next? Next after what, Rochelle?
You want me to like tell you the answer? I think it is. Is
No,
that
no, no.
you want?
What are you doing next after? So it says, basically it says, what should the social worker do next? Next after what?
In order to best assist the client
It will
about,
be next after you complete the assessment. So it's telling you that you've already completed this psychosocial the assessment. What should you do next? So you're looking for something that you do next after you complete the assessment. That's going to address this woman wanting to work on being more confident. Okay.
identify.
All right. Oh, you're going too far. We ain't even got there yet. Do you understand what the question is asking you first before you pick
I
an
do.
answer? All right. So what the next thing we do in order to best assist this client, what the next thing we do be to provide the client with psychoeducation. Pause or scratch?
I would say
Scratch.
Scratch, okay. Why are we scratching?
I mean, to provide the client with psychoeducation on self-confidence. The client already feels that she needs more, that she would like to work on being more confident at work.
Okay.
So I don't think that providing education on self-confidence would
is
really
gonna
be
address
the
that. Okay. What about B? Assist the client with identifying classes aimed at building self-esteem. What y'all say? Pause or scratch?
scratch.
scratch.
All right, and I think this will be along the lines of what you just said for A as well, Rochelle. So what about C? Explore past issues that have caused self-esteem issues.
Scratch.
Okay, tell me why we're
Scratch.
scratching that.
We don't go back in the past.
Yeah, we're working in the here and now.
Yeah.
Okay. What about D?
I would say
Pause.
acute.
Okay, so everybody's okay with D?
Mm-hmm.
Identify the outcome that she hopes to attain from this behavioral change.
I think so.
Okay. All right. So one thing I want to point out, I think that was Miss Yolanda. Explore past issues. We don't go back in the past. Not true. Okay. Whenever you're doing an intake interview, sometimes you do have to do a history, like you're doing their sexual history, social history. You want to know about things that happened to them in the past. If they had past traumas, that could be relevant to the issues that they have today. Okay, so I just want to point that out. Not saying that's the answer, but I don't want you to think that and get it wrong with another question. So yeah, sometimes you do go back and, especially in the intake interview, you go back and explore past issues while you're trying to gather information. So in this case, it says the social worker has already completed the assessment. So like Rochelle said, now that means we're going into the middle phase. So in the middle phase, after we do an assessment, we go into the planning phase. And the planning phase is where we identify their needs and then we set goals and objectives. So verbatim, almost, the answer here is identify the outcome that she hopes to attain from this behavior change. So that's basically planning. You want to know, okay, so what is the goal that you want to attain? And that's after you do the assessment. So do y'all see, this one was kind of a little simpler, but I wanted y'all to see how the helping process fits in. So you see how, Rochelle, when you come out of, it says after you complete the assessment, then you go to the next thing in the helping phase. That's for these clinical intervention questions. Okay, any questions about that one? And this is one of Abgar's questions. All right, number 5, anybody want to take this. Oh, Miss Bridget, you take this one.
A social worker is working with a gay teenager who is contemplating whether or not he is ready to come out to his family. What is the first step in the coming out phase?
So
Okay,
this is recall. So you can go ahead with the answer choices.
right. So A, begin an intimate relationship with a same-sex partner. B, self-discover.
Wait, we
This
pausing or
is-
scratching?
Oh, I'm
Is
sorry, I'm
A-
sorry.
Is A the first step in the coming out phase?
Scratch.
It's scratch.
All right. Go ahead, Miss Bridget.
Okay, B, self-discovery and acknowledging their own sexual orientation. I would pause.
Everybody else want to, anybody else say scratch?
I would say pause.
Okay. All right. Go ahead, Miss Bridget.
C, sharing their sexual orientation with their close friends and family. Scratch.
Okay. So that's not the first step in coming out. All right.
D, joining a support group for those struggling to come out. Scratch.
All right. So everybody okay with B? The first stage of coming out is self-discovery and acknowledging their own true sexual orientation.
Mm-hmm.
All right, so let me tell y'all this one. This is right. This is the first step. And what y'all need to know, because the exam may not ask you what's the first step, but y'all need to know the coming out phase. So if y'all don't know it, if y'all don't know it, then y'all need to know it. The first stage is self-discovery. The second stage is when they disclose themselves to others. The third stage is when they begin to socialize with others. The fourth stage is positive self-identification. Is when they start feeling good about, accepting themselves. And stage 5, integration and acceptance. That's when they actually start integrating with other LGBTQ members. And then stage 6 is just their journey. So make a note, if y'all don't know the stages of coming out or the phases of coming out, know that, and also know the stages of gay identity development. Because those are the two things that so far, the few questions that I've seen are centered around just knowing the phases of coming out, what's going on in each phase, and knowing about gay identity development. Okay. All right.
I'm sorry, where did you say we can find the gay identity part at?
Oh, just Google it. Just Google gay identity development, and it's by, I think her name is Cass, C-A-S-S, I think. It'll come up. It'll come up, as well as the stages of coming out.
Yeah, I saw a lot of these on my exam. I was like, oh my God. I was like, I don't know about these gay people. Like,
Yeah, you gotta, oh my goodness, but you gotta
not to
know.
offend anybody, but I was like, I have no idea.
Yeah, I understand, but you gotta know like the process, because when the questions ask you, the questions are not just asking you about gay people. They're asking you about, LGBTQ processes, and at what phase do they need the most support, like those type of questions. So you gotta know how, because say for instance, if you do get someone from the LGBTQ community, they want to know that you know how to work with these clients, or just be culturally sensitive and all of that. So you have to know how the processes work, or what stage they're in, what phase they're in, to help you intervene clinically. Okay, so y'all know that, because like y'all already seen that there's a lot of questions on there, because like I told y'all earlier, anything that's really prevalent in society today, they're putting it on the exam. So anything like abuse, and that's all abuse: domestic violence, sexual abuse, child abuse, neglect, elder abuse is another one that's been kind of common on there, LGBTQ issues, all of that. That's what y'all gonna start seeing. Whatever y'all notice, natural disasters like these school bombings and stuff surrounded on how to work with those type of individuals that have been through those type of events, all of that, y'all. So make notes that these are the type of community questions that are flooding the exam these days. And I can tell y'all, because it's kind of new, y'all not going to find it in any book. So the information that I have, I literally had to research it outside of our standard, AppGuard book and anything else. So I don't really know if they're going to start adding into new textbooks at school. But for right now, for us, y'all, we don't really have no study resources because this is like new within the last few years. And so they're just throwing it on the test and nobody even knows where to go get study resources from. If you keep up with the NASW website, they do post a lot of information on there, like updates with new laws for LGBTQ, and all kind of stuff like that. So that's where I get a lot of my information from. All right, so let's go to question 6, the first question. Anybody want to take this first question?
I'll take it.
Okay, go ahead.
It says a hospital social worker is conducting a clinical evaluation with a 79-year-old man recently widowed who has encouraged to obtain mental health services by his minister. He expresses concern that since the death of his wife of 50 years, he has not been able to sleep, has little energy, and often skips meals. What should the social worker do first?
Clinical intervention. So that means we breaking this one down. Whenever you see them first and next, let's break it down. What phase are we in? What phase of the helping process are we in?
So I would say that we're in the first phase.
The beginning.
Mhm.
Because this says we're conducting the clinical evaluation. Is that okay?
And then I guess my presenting problem would be he expresses concerns about, the death. He has low energy, not able to sleep, that skips meals.
Okay.
So it's saying, what should the social worker do first?
Okay, so first means we're looking for what?
Like something in the beginning?
Nope, we're looking for the most important thing. Don't forget it. I ain't gonna let y'all forget it. Y'all can hear me and y'all sleep. I be saying the same thing so much.
We need to
important.
acknowledge the client's feelings of loss.
Nope, we don't do that up in here. That's what the other people teach. I don't teach that first. I'm not saying that's not the right answer. I want you to focus on what is the most important thing. I'm not saying that's not the answer, y'all. Let me clear that. But a lot of people come and they are taught that, oh, when you see a first question, you always acknowledge the feelings first, and sometimes that's not the answer. Okay.
But we need to.
Oh, I'm not saying, hold on. I haven't even looked at the answer choice yet. See, Rochelle, you be beating me. I haven't even got to the answer choice yet. I just want y'all to put in y'all mind, when y'all see first, don't think of feelings. Think of most important. Don't think of acknowledge feelings. Think of what's the most important thing I need to worry about according to
That
the
he has not been able to sleep and has little energy and skips meals.
Exactly. All right, so Miss Yolanda, is the most important thing we're going to do about the fact that this man, we're doing a clinical eval, so we're in the beginning, and y'all, I'm going to take y'all back up here. When we're in the beginning, she said we're in the beginning, so that means we are engaging and are assessing. So that means our answer has to be doing one of these because that's where they say we are. We can't be ending a therapeutic relationship in the beginning. So it doesn't make sense. So that means our answer has to be engaging and or assessing. So with that little note, Ms. Yolanda, is the most important thing about the fact that this man who wife of 50 years and died and he can't sleep, eat, and got no energy, is the most important thing we need to do is to conduct a mental status examination. Pause or scratch, y'all.
Scratch.
Okay, why are we scratching?
I say pause.
Okay. Tell me why are we scratching the scratches? Who said scratch and why?
I did because, I mean, you're conducting a clinical evaluation.
Okay. All right, so what about B? Consult with collateral sources. Is that going to be the most important thing we do about this client who has not been able to sleep, has little energy, and often skip meals?
Scratch.
Okay. Why are we scratching that one?
I said pause.
Oh, I'm sorry. Pause. Okay. Somebody said scratch?
I said scratch as well.
Okay, so why we want to scratch that one?
Well, one, if we're in the beginning, I don't think it says engagement or assessment, so I don't think I would do that in the beginning.
Okay, just want to hear y'all rationale. All right, what about C? Acknowledge the client's feelings of loss, Rochelle. Pause or scratch?
I guess scratch.
What? Wait a minute.
No. I'm sorry. Pause that one.
Okay. Okay. All right. Yeah, I see somebody typing in the chat. I can't really see the chat. Is somebody? Oh, okay. Somebody copied it, y'all, for y'all in the chat. Amen. There y'all go. Okay, and Miss Naomi, I heard you, Miss Naomi, no problem. All right, so what about D? Provide information about depression. Okay, in a clinical eval, okay. While we scratching it, anybody want to pause that one?
No, I was scratching. Yeah.
All right, so we have some little riffraff about conducting a mental status examination. So the person who feels like we should do that, tell me why.
We're in the beginning phase, so I believe we should do an assessment. And plus it says, death of his wife, 50 years. He's not able to sleep. He has little energy, just a lot of red flags going on. So
Red flags of what? What red flag in the scenario tells me that we need to do a mental status examination?
I was thinking that not being able to sleep and the little energy.
MSC is usually for people, I mean, we're trying to test to see, you know, their cognition, if they're all the way there. Like, you know what today is, can you count backwards? Like, we're trying to test, yeah, their mental status. So, just these symptoms are not like mental issues. He can't sleep. And then, yeah, so definitely A is, we can rule A out. So B, somebody said they want to keep B as well. So consult with collateral sources. Somebody said they want to keep it. I don't remember who.
I did.
Okay, so tell me why.
So the reason that I said consult with collateral resources, because maybe he needs to be seen by a doctor because he has low energy and he's skipping meals. And so that's the reason that I said maybe he needs to see a physician.
Okay, all right, so C, my C's, y'all tell me why we're gonna acknowledge the client's feelings of loss first. Why is that the most important thing y'all want us to do?
Yeah, I like C as well.
But why? I just want to know y'all rationale, because y'all got to know when y'all picking these answers, y'all got to know why the answer is the answer. That's how we learn. So y'all mean to tell me y'all didn't pick this answer and y'all don't know why it's the answer? Rochelle.
I'm saying, okay, well,
because you had a good rationale earlier. What was your rationale
yes.
about acknowledging the client's feelings?
Well, he was encouraged to obtain mental health services due to, I mean, he just lost, his wife of 50 years. So, and then now he's not able to sleep. He has little energy and often skips meals, which I think that that's very important. That's something to definitely address. However, I think that listening to the man and acknowledging what he's feeling is the best way to go about beginning to help him.
Because we're in the beginning phase of the process. So consulting with collateral sources, is that engaging and or assessing here and now? Is that something we're doing here and now in the moment?
No, ma'am.
No.
Nope. So that's not our answer. So I just wanted y'all to work that out like that so y'all can see it. So in this case, because it specifically tells you that he expresses concern since the death of his wife, this man is grieving his wife. And this is recent, y'all. Whenever I see something that recently happened, I pay attention to it because the time frames are, will tell you a lot. And so this is something that just happened. So we definitely want to acknowledge the client's feelings of the loss, because this is something that we want to engage him and build rapport and build trust with him. And we do that by, empathizing with him and all that. That's all part of engagement. So that's the phase that we're in. So that's why we're going to do that. Any questions about that? Rochelle, I didn't want you to second guess yourself. You almost did. You scared me.
I know I do that often, but I think I was pretty confident that it was C.
You were so good. Good. I'm glad you didn't change your mind. All right, let's go to 7. Anybody want to take it?
I'll take it.
Go ahead.
A social worker receives a call from a former client complaining about her new social worker, Jessica, at another agency and wants the social worker to intervene. She reports that the new social worker does not listen to her and rushes through their appointments. The social worker knows Jessica. What should the social worker do?
So this is just, it doesn't say, Ms. Shalonda, it doesn't have what should the social worker do first, what should the social worker do next. It just says what should the social worker do, which is the same as the social worker should. So normally in these cases, when they just leave should standing out by themselves, y'all can bet y'all last dollar that this is going to be an ethical question. It's going to be something surrounding around what is the most ethical thing you need to do. So Rochelle, tell me what's going on. What's our issue here? Because this is the ethical question. We don't have to worry about phase of the process and all of that because it's not that type of question. So what's the issue here? What's our priority issue here?
Well, the issue is that the former client, you know, who's complaining about her new worker at another agency wants me, I'm just going to say me, you know.
I want to know, tell me verbatim from here. Just
okay, wants the social worker to intervene. She reports that the new.
Okay, right here. Okay.
And she reports that the new social worker does not listen to her and rushes through her appointments.
Okay.
So what should the social worker do?
All right. So we're looking for the most ethical thing. Does everybody have a clear understanding on why this is geared towards ethics, doing the most ethical thing?
Mm-hmm.
Okay, when it just says should, I want to make that clear. When y'all see what should the social worker do, like just period without nothing else, no first, next, all of that is leaning towards ethics. So Rochelle, is the most ethical thing we need to do is call Jessica to inform her of the client's concerns, pause or scratch?
Scratch.
Why are we not going to call Jessica and tell her that this client is, you know, complaining about her? Why wouldn't we do that?
Well, because it wouldn't be, I mean, that it's really not our place to do so.
Right. That's not ethical. All right. What about B? Should we advise the client to talk to Jessica's supervisor?
Scratch it.
Why not? Why wouldn't we tell the client, well, look, I can't help you. You go talk to a supervisor about that.
Because, you know, I mean, if I say why, I would kind of be given the answer a way that I think would be the answer.
Okay, go ahead. Keep going then. What about C?
I think that would be the proper thing to do.
Okay, tell me why.
Well, it's putting the social worker in a uncomfortable situation, you know, with a former client complaining about her new social worker who works at a totally different agency.
Mm-hmm.
And obviously the social worker, there's nothing she can do about it. So encouraging the client to discuss, you know, that issue with the new social worker would probably be the most
Ethical.
the ethical or effective way of handling that.
Okay. What about D? Will we call the agency and just ask that the client be reassigned?
No.
Okay. So anybody disagreeing that the answer is C? She said the answer is C. Anybody disagree with that?
No, ma'am.
All right. So spot on, Rochelle. Absolutely. I like the rationale. Very well. You just encourage her to discuss this. There are ethical issues involved in engaging in a relationship with a former client. Number one, that's in the code of ethics. Who is presently in treatment at a different agency. This would interfere with the primary social worker client relationship. So just note to self, we don't get involved with other colleagues' clients, even if we did know her. See, some people get confused. The fact that she knows, like, oh, well, that's my homegirl. I could call in and talk to her for you or whatever. We don't do that. That's not ethical. All right. Number 8, I'm going to go ahead and take this one. In an initial interview, a 5-year-old girl was anxious and emotionally constricted. In order to lower anxiety and begin a working relationship, what should the social worker do first, Ms. Yolanda? This is a clinical intervention question, okay? So what phase of the process are we in?
So we're in the beginning.
We are in the beginning because it says in an initial interview, it doesn't tell us after no assessment or anything like that. So that tells me that we are engaging and are assessing, and our answer or our intervention that we pick has to be in line with that phase. So we're looking for something that is engaging and or assessing the client. So we have a 5-year-old girl. I always pay attention to the ages as well. Who's anxious and emotionally constricted, okay? We need to know what the question is asking us. And the question is asking us, in order to lower anxiety and begin a working relationship. This is what the question is asking us. In order to lower anxiety and begin a working relationship with this 5-year-old who's anxious and emotionally constricted, what is the most important we need to do? Is it A, do we need to assure the child that she is safe and can express her feelings?
Pause.
Okay.
Yeah.
All right. What about B? Do we need to involve the parents in the treatment?
Scratch.
Why are we scratching?
Because the parents may be the reason.
Okay. All right. So what about ask the child gently what is bothering her?
I'll say pause.
Pause.
Okay. And what about D? Relate to the child through the use of play materials.
Scratch.
Correct.
Okay. Why are we scratching?
Because we're unsure right now. You know, what is causing the girl to, I mean, I don't know how to explain it, but without knowing much about the little girl, how can we relate to her?
Ooh, okay. So we're in an initial interview. We're in the beginning phase of the process. We are engaging and or assessing. Our answer has to reflect as such. We have this little 5-year-old. She's anxious and she's emotionally constricted, meaning she's just, kind of like not really there emotionally, not trying to be there emotionally. So in order to lower her anxiety, to start working with her, you're in the beginning phases with her. You're trying to build rapport and trust with her to begin this working relationship, to make her not so emotionally constricted, to lower her anxiety. What is the most important thing you should do? Should you assure the child that she is safe and can express her feelings? Or should you
Yes.
ask her gently what's bothering her?
I would say assure the child that she is safe and can express her feelings.
Anybody else?
I agree.
I agree too.
Okay. Well, y'all all agreed wrong, unfortunately, y'all. And this one is going to shake y'all up. So because I got it wrong, I want to just drive it one more time. You are in an initial interview. You are in the beginning phase of the helping process. So you are engaging and or assessing this child. She ain't really trying to let you assess her because she's anxious and she's emotionally constricted. So you're trying to break the ice with her. You're trying to lower her anxiety and to begin this working relationship. So the best thing that you can do, or the most important thing you can do, is relate to her through the use of play materials. She's 5. For people that see kids, we know sometimes we have them little Lego blocks in our office and little dolls, and just like, hey, just to break the ice with a 5-year-old, because telling a 5-year-old is safe, that she can express her feelings, she ain't understanding that. You're a stranger. You're in the beginning phase with her. She don't know you. So you have to find ways to relate to her in ways that she can relate, and telling her that she can't relate to you, telling her that young children do not often express their feelings verbally, but rather act them out through play. So, you may have a doll if you work with children. You may have dolls in there. You may have blocks or Legos or some little cars for the little boys. That's what we use those two to kind of relate to the kids or kind of loosen the kids up. Make sense? What y'all thoughts about that? Tell me what your thoughts are about that now that everybody got it wrong. I want to know what y'all thoughts are. Somebody got to have some thoughts.
I see it now. That
Okay, good, and that's perfect. As long as you see it now, that's good. What about you, Rochelle? You good with it, or is there still some questions? Rochelle, okay. Everybody good with it?
Yes.
Okay. All right. So Here's the next question. Anybody want to take it? These next questions be a little tricky.
Mhm. During an initial interview, a social worker asks a client a question. The client blushes and becomes silent. What should the social worker do next? So we're in the beginning phase because we're doing an initial interview.
What is the problem here? Or
The
the
client
issue of concern?
blushes and becomes silent. What should the social worker do next? Okay.
It's your interview. Remember when the beginning, so you know what we're doing. We're trying to engage the client. We're trying to build rapport with this client. You're trying to assess him, but he acting out, you know, or he or she is acting shy, blushes, and becomes quiet when you ask a certain ask a question. What's the next thing you're gonna do? This is in the section where they talk about the helping process.
Okay, so A asks the question again in a slightly different form. I would say scratch.
Okay.
B remains silent for a few seconds. I would pause. C, delay discussion of the topic at hand. I would scratch. D, identify the emotions the client may be experiencing. I would say scratch.
Anybody have any that they would want to pause before she continues? Okay.
Pause on D just because, I mean, I feel like it's B, but then I also want to acknowledge, like, you know, her emotions. So I'm between.
I would say D.
You said which one?
D.
Okay. All right, so we stuck between two. This happens on the exam. So when you're stuck between two good ones, y'all have to go back and compare each answer choice with whether or not it addresses what the problem is and what the question is asking of you, and make sure that it is related to what the phase you're in. So let's do that. So we're in an initial interview, so we're engaging in our assessment. We asked the client a question, the client started blushing and got silent. So the next thing that we should do, because it's asking what should the social worker do next, after you ask this client a question and the client blushed and became silent, what will you do? Will you remain silent for a few seconds? Is that, or will you identify the emotions the client may be experiencing?
Yes.
Because I feel like it's engaging with the client.
Which one is engaging?
D.
How do you identify the emotions? Can somebody give me an example of that?
So, you know, like if you're blushing and you sit back in your seat or something like that and kind of like, you know, I don't know.
So
like
how will you
body
identify
language.
the emotions for the client?
Maybe it's a body language.
Okay. So what about remaining silent for a few seconds? Is that something that we would do or not do, or any rationale around that? What's that about?
I said B because I remember reading in the Don Apgar book that I guess I'll just stick with B. I don't know if it's right.
Yeah, if I was taking a test, I automatically would have went to B. But just doing this class, I probably would have jumped to D because it's doing something. But if I was reading the test, I would have jumped to B.
What you mean it's doing something?
Because well, identifying her emotions is like doing something. Like, so if she's crying, I'm identifying her emotions. Like, oh, okay. Like,
that's interesting dialogue. Okay, so let me give y'all the answer with the little small rationale. Silence allows the clients to formulate their thoughts and deal with their emotions. So y'all, when you're reading, and this isn't Dawn Apgar's book, when you're reading about the helping process, you give the client time to process their own thoughts, their own emotions, or even if they say something and then kind of draw back, don't you just jump in. Don't be quick to jump in and start, giving your 2 cents or whatever. Just silence will allow them to process their thoughts and what they said, or, why she's blushing. And then, I mean, you don't stay silent for 5 minutes, but at the same time, you give the client, when you're trying to engage and build rapport with the client, you make sure you give them moments to, kind of process their own thoughts. This is just communication, how to communicate with client when you're building the therapeutic relationship, and it isn't done at first. So yes, you will remain silent for a few seconds just to see what their follow-up response is gonna be, because you asked them a question. So, give her a chance to answer. Just because she started blushing doesn't mean, he or she started blushing doesn't mean that they're not going to answer the question. So this one is actually kind of like a recall question as well. You could break it down because you know where you are in the process, but it actually is a recall question of just knowing how to communicate when you're building the therapeutic relationship. And that's more of a question that's you'll probably find on the master's exam. All right, we got another LGBTQ question. Anybody want to take it?
I'll take it.
Okay, hold on 1 second. Let me just send it down here so we can get the picture. All right. Okay.
It says a social worker at a community agency wants to conduct a needs assessment to determine areas of program development to better serve the LGBTQ community. All of the following activities might be included in a needs assessment, except.
Ooh, this word is step, y'all. This word be tearing me up. So, all right. So what's going on in the situation? Is it one we need to break down? It sounds like a question that, we just kind of need to know the information, right?
Yeah.
All right. So what's going on? We just got to identify what's going on.
Mm-hmm. So they need to she wants to conduct a needs assessment to determine the program development for this community. So all the following activities might be included in this assessment.
In a needs assessment. So this question is a community question, it's a macro question, and you just need to know what's included in the needs assessment. Y'all gonna need to know this because they ask all kind of questions around, the macro working in the macro community and, needs assessments and stuff. So the best way for people, if you like me, you struggle with accept because I be thinking everything backwards. I just drop that accept and I'll say which all of the following might be included in a needs assessment. And I check off all the ones that I know that are included in a needs assessment, and the one that's left is the exception. That's how I do it for anybody who may struggle. Some people may can just read the exception, but my brain don't process like that. So conducting a survey amongst the LGBTQ community, is that an activity that will be included when you're doing needs assessment?
Yes.
So we can scratch it. B, holding a forum for members of the LGBTQ community. Is that something that will be in a needs assessment?
I would say yes. That's like holding a meeting.
Yeah, like a little forum kind of, you say, I say, we say type of meeting.
Yeah, I would say yes.
Okay.
You bring them together.
All right. What about identifying LGBTQ individuals or groups with influence to promote and fund programs? Is that going to be something that might be included in the needs assessment?
No.
I would say pause.
Okay, so we got to pause. All right. So what about D, collecting service statistics regarding use of current LGBTQ programs? Will that be included in a needs assessment?
No.
Service statistics.
I would say yes.
Okay, so somebody said no.
I said no.
Okay, so we got C and D. So y'all, we talking about a needs assessment. If you don't know it, make a note so you can go back and look over needs assessment, because even outside of LGBTQ, working in the community, they're gonna ask you some questions about needs assessment. So you have to know what's all included. A needs assessment, do y'all know what a needs assessment is? Anybody know what a needs assessment is? I want to take a guess.
Like what you need to run your program? Or
like just an assessment of what you need for this program. You're trying to develop a program to better serve the LGBT community. So you got to figure out what it is they need so that you can serve them better. So you're
I
doing a
think
needs
it's
assessment.
better. I'm sorry.
Oh, no. You said you think the answer is A as the exception, or is A something that will be in the needs assessment, or are you saying it's not? Because that word accept trips us up.
I think it's A or B.
I'm confused. So A or B as far as that's not included in a needs assessment?
No, I would say that it would be.
Right.
Needed.
So you process like me then, Rochelle, because that means we scratch them out, because we scratched out all the ones that are needed, because this is an accept question. And so I have to think of it. Yeah. That's how I think. That's how I process it. I process it like that. So I have to take the accept off in order for me to understand it correctly. So yes, A and B are definitely something, you're right, that's included in a needs assessment. So we're gonna scratch them out because we're trying to find the one that's not. We're trying to
D.
find the exception. Which one?
D. D should not be in there.
D. Okay, so we got it. So we still stuck between C and D. I need somebody to give me some rationale. Which one we gonna go with? Which one is not in a needs assessment, y'all? We got a D.
I would say program funding, to promote the funding part, because I think that and I'm probably could be wrong, but I feel like it could come later. So I would want to know, like, you know, the statistics regarding like what programs work, what programs didn't work. That's just my thought. I don't know.
Mm-hmm. Well, that's a good thought, because that is definitely correct. The trying to get people with influence to promote the program and all that will come later. And that's not something that's done in the needs assessment. In the needs assessment, we are focused primarily on what this community needs. Okay, and right now we do that by surveys, we hold forums so they can tell us, and we do that by statistics. Like, we need the facts and, you know, those type of things we're trying to get. So we're trying to develop this program. Now, once we get our program, figured out, then we can start soliciting people with influence to promote it, to help us promote it and raise funds for it. But we got to figure out what they need before we start trying to raise money.
So would C be stakeholders?
Yeah, it would be stakeholders. Stakeholders are anybody that has any type of interest, financial interest, usually in a program or organization or whatever. So yeah, it could be stakeholders. It could be people, you know, like some popular LGBTQ influencers on social media, to you get them to, you know, make a few posts or make a video or something like that to promote the program and all of that. But that's not done, of course, in the need. So that is the exception.
Good question.
Yes. Got them community questions. Whew.
I hate them.
Yeah. Yeah. All right. And it's hard to find material on them, y'all. I had to buy a whole community book, just a book on, like, it's just a book for community, because you ain't getting it in none of the other books that's floating around. So, all right. Number 11, we got a most questions. So a school social worker is starting a group for gay and lesbian teenagers. What factor would be most important for the social worker to consider when starting the group? So you're starting a group for gay and lesbian teenagers. So when you're trying to start this group, what is the most important factor that you need to consider when you're starting this type of group? Is it starting a group for gay and lesbian teenagers may cause them to feel stigmatized, cause a scratch? Is that the most important factor we need to worry about? Or we need to consider, let me say that.
I would say scratch.
Mm-hmm.
Okay. A support group should be facilitated by the student themselves. Is that something we need to consider? Cause a scratch.
Say scratch.
Okay. Groups that single out gay and lesbian students are likely to make the students targets for bullying. Is that something we need to consider?
Scratch.
There's only one left. I sure hope y'all with it.
On the looks of it, though.
Right? Starting a group for gay and lesbian students can provide support and reduce the risk of suicide. Is that an important factor to consider?
No.
Well, honey, which one is? Because I thought y'all was all on the same page and she bust out with the no. So which one is it? That was a strong no.
Well, she's starting the group for gay and lesbian teenagers. So the factor to me that would be most important for the social worker to consider would be, I would say
Go ahead.
a support group. Not necessarily, but I don't know, because it shouldn't be facilitated by the students themselves,
not
but
the
more like an
answer.
open floor.
Right, so that's not the answer. That's not it. The students should not be facilitating this group by themselves. So that leaves us with starting a group for gay and lesbian. Okay, so you're saying that starting a group for gay and lesbian teenagers may cause them to feel stigmatized.
Oh, no, never.
Okay.
Don't listen to me.
I love it. So we gonna stay with D.
Yeah,
Rochelle
let's stay
said,
with D.
I was say Rochelle said, don't listen to me. So yes, D is the answer. A supportive environment can help reduce feelings of isolation and may decrease the chances of suicide. And since the group membership will be voluntary, this is important. It is very unlikely that the students will feel stigmatized because it's a voluntary group, right? It is most likely that an adult will be needed to facilitate the group because it's students and help them deal with the issues. And attending group is unlikely to lead to increased bullying. So yeah, just factoring in that you're giving them a supportive environment. That's the most important factor. Any questions about that one? Rochelle, you and I, we think too much alike. We process alike. I be thinking all
I know.
in my own mind. All right. Somebody want to take this first question?
I will.
Miss Kim, can you move it up some? Because my eyes keep going to the one that's above it. I'm sorry.
Oh, no problem. No problem. If you need me to zoom in, I could do that too.
Okay.
Y'all all right? Y'all need me to zoom? Let me zoom in one more time just to, okay. There we go.
A social worker is meeting with the parents of a 9-year-old girl who reports having difficulty dealing with the girl's recent behavior. She was caught stealing money from her teacher's desk a week ago and has collected an array of pencils, crayons, and other school items from her class that doesn't belong to her. What should the social worker do first? Oh, do you want me to read the options?
Oh, no. So tell me, what phase of the process are we in?
Beginning.
Yep, we're in the beginning. And one thing that I've recently pointed out, y'all, if it says we're meeting, then that it hasn't failed me yet. That tells me that we're in the beginning, even though it doesn't specifically say, from all the questions that I've been working out, a social worker is meeting, that insinuates the beginning. So that means we're engaging in or assessing this client. So we have a 9-year-old, Rochelle. We meet with the parents of a 9-year-old. What's going on in the situation? What's the priority issue here?
The parents are reporting having difficulty dealing with the girl's recent behavior.
Okay. So everybody is in agreement that that's a priority issue?
I mean, well, the issue is the girl stealing, but the presenting problem is the parents are having a difficult time dealing with her behavior.
Okay. All right, so what is the question asking of you?
What the social worker should do first.
Okay. So that means what's the most important thing you need to do? You're meeting with the parents of this 9-year-old girl who they're having difficulty dealing with this girl's behavior.
I would say, I'm sorry.
Go ahead. No, you go ahead.
I would say obtain consent from the parents to consult with the girl's teacher.
Okay, so she already got her answer. Anybody, let's go to B. Anybody feel like we need to scratch A? So A is up there. So what about assess the parents' disciplinary measures? Is that something we would do?
No, not for.
No, not yet.
Okay, I'm over here saying that. What about C? Are we going to inform the parents that this behavior is age appropriate because children at this age do not understand causality?
No. Correct.
My 9-year-old didn't understand.
I would say pause.
Okay. So what about D? Refer the child for psychological testing to clarify factors underlying the problem.
No, scratch.
Okay. All right, so we got A. Rochelle said that it was A, and then somebody wanted to pause. Inform the parents that this behavior is age appropriate.
I said C because, I mean, they're already complaining about difficulty dealing with her behavior. And so she's stealing. And so I need to address her, what they
So you
can.
saying that it's normal for a 9-year-old to steal, it's age appropriate for a 9-year-old to steal because at 9, they don't really understand causality.
Yeah.
Okay. Anybody else got anything in regard? I tried to find a simpler word with.
I would say because
I would say informing the parents that the behavior is age appropriate wouldn't be, and I'm not trying to, you know, sound like I'm disagreeing, but at 9, well, I mean, they're having trouble dealing with her behavior.
Mhm.
So, but at 9, I wouldn't clearly be confident in saying that this behavior is age appropriate.
Okay. So y'all, let me ask this question. What if we focus on her behavior here? If we focus on the fact that she got caught stealing money from her teacher's desk a week ago, and she has collected an array of pencils, crayons, and other school items from her class that doesn't belong to her. What if we focus on that? Will we still inform the parent that, you know, this is age appropriate because a child this age does not understand, you know, her actions?
And I would say A, because she's stolen from the teacher.
Okay, so that's good. This is really good. I'm so glad for this one. So y'all, the answer is A. And let me tell you, I let y'all be confused because what happened, Rochelle, you started off and you didn't identify the correct presenting problem, but so I just wanted to see how it was gonna go. And it went normally how it does go, especially on the exam. Rochelle you were able to pick out the presenting problem out the gate, like before you even really realized what the priority issue was. So she knew her answer before we even started. But that doesn't always happen. That's not always the case because as you can see, if everybody, the rest of y'all who was focusing on this as a presenting problem, we're having trouble trying to figure out, okay, which one is it, or no, it's C. But when you focus on the actual, you know, issue here, most of her behaviors are happening at school. She's meeting with the parents of 9-year-olds. She's having difficulties because of her recent behavior. Those behaviors was that she got caught stealing. I told y'all when y'all see recent, pay attention to that time frame. It means something that just happened. So her recent behavior, which was she got caught stealing money from her teacher's desk, okay? And she collected all this stuff and other school items from her class. But I mean, she's doing all of this at school while she, you know, in her class. So yeah, I want to ask this mom, can I talk to the teacher and see what's going on in the class? Can I, you know, get a better understanding from the teacher? That's the most important thing right here. Basically informing the parents that it's age appropriate, that's disregarding her behavior. And she's 9. I'm kind of with you, Rochelle, on that. I'm not even really sure what's normal at 9 according to human behavior. I'm not gonna act like I do, but I know according for me personally, 9 years old, you know what you're doing, sis. You know stealing is wrong. My 5-year-old could tell right now, she knows stealing is wrong. So I would think that writing it off because, you know, she don't really understand, that's not really logical for a 9-year-old because at 9, I believe they do. But irregardless of that, the real presenting problem was her recent behavior, and they spelled the recent behavior out. So that's what y'all should have focused on. And when y'all did somebody was like, oh, okay, the answer is A. So that's just more or less, you know, make sure we're picking out the right presenting crowd. Any questions about that? Let's see. The girl's behaviors are primarily being exhibited at her school. Yes, her teacher may be able to shed some additional light on her behavior. The parents' disciplinary measures, that's not important. No. Oh, sister girl. The social worker might refer her. Yeah. So yeah, it's yeah, let's see what the teacher got to say, because all this stuff is happening at school. Any questions about that?
No.
Nope. All right. Would anyone like to take number 13?
I'll take it.
Okay.
It says, after a student committed suicide at a local college, a social worker is asked to provide crisis intervention services. After informing the students about the services and confidentiality, what should the social worker do next?
All right, we got this good old next question. So that
So
means,
I would say we're in the middle phase.
okay. All right, and what's our issue?
After informing the students about services and confidentiality, what should she do next?
Okay.
So the issue is the student committed
ahead.
suicide.
This
And
is
she-
it right here?
Yes.
That's it?
Oh, no, so she's providing crisis intervention.
Okay. All right. So heavy on the crisis intervention services, y'all. All right. So what's the question asking of you?
What should we do next after she's already provided services? Yeah, confidentiality.
Okay. So what we gonna do? So we about to provide this crisis intervention. We done already told them about the services, and we already explained to them the limits of confidentiality. What are we doing next? You can go ahead and take us through the answer to us.
It says, educate the students about the grief process. I would say,
Pause or scratch,
No.
y'all.
I would scratch.
Okay. Anybody want to pause it? Okay, we're gonna scratch it since we don't know. Go ahead with B.
It says, allow students to express how the loss is impacting them. I would pause. Talk with each student individually. I don't know, I would scratch that.
Okay, anybody want to keep this one? Okay, go ahead.
The only reason that I said scratch because it says informing the students. So that means more than one. So why would I pull them like separately if it's
Okay.
students? I don't know, maybe I'm looking too much. It says provide referrals to private counselors. Like, no, that's what I'm there for.
Okay, so there's only one left. So how you feeling about B? Allow the students to express how the loss is impacting them. So you're providing crisis intervention services. So you didn't already told them about the services and the confidentiality. Where are we going next?
Yeah, it's to start the process, start the session.
Mm-hmm. And so that's going to be what?
B.
Okay. Anybody have any questions about that one?
You got me nervous over here. God, Jesus.
I know that exam have y'all nervous too, so don't do me. I'm trying to play like I'm the exam right now. I'm Miss ASWB for the moment, because y'all be nervous in an exam too. But I want y'all to know how to think around these questions. Don't let me get y'all off track. So I might say something or act something a certain way just to see if y'all gonna stand on your answer or y'all gonna think the right way. So, but I mean, good. You did good. Don't. The moral of the story, don't question yourself. Don't second guess yourself. That's where a lot of us go wrong at, especially on the exam. We get stuck, we get to them second two, and we start second guessing ourselves. Just work it out. You got it. All right, 14. Anybody want to take 14? Y'all tired?
A
Y'all
social,
think 2 hours is too long? Okay.
I don't.
Okay, all right.
A social worker employed by a retirement home is approached by a client for help in establishing a recycling program in the facility. The social worker decides to co-host a meeting with the client to discuss the idea with other residents. What is the most likely reason for this approach?
All right. What kind of question is this?
This is something that we're gonna do urgent and priority. We're gonna meet the client where they are.
Okay, we're gonna do what makes the most sense because they're asking us what is the most likely reason for this approach. So we're gonna do, we wanna know what's the most likely reason for that. However, what type of question is this? When I ask that, this is basically one of those good old macro questions because they're asking you to help in establishing a program. So this is like a program development question. So y'all, if y'all don't know y'all program development, the steps of program development, all of that, just review it because these questions, they don't ask you directly, they ask all kind of ways around it. So they want you to develop a program. All right. So in here, they want you to do this, and this is what you decide to do. You decide to co-host a meeting with the client to discuss the idea with other residents. Why are you doing that? Like, why are you taking this approach? What is the most likely reason? What makes the most sense for you to take this approach in trying to establish a recycling program at these people's facilities?
Okay.
So think about the situation. You at the retirement home, the client comes and he wants help because he wants you to help him establish a recycling program at this retirement home. So you decide, okay, I'm gonna have a meeting and I'm gonna co-host with this client, with the other residents to get their ideas, to see, what they want to do, how they want to, assist. Why would you do that? Would it be antagonizing administration could be dangerous? Is that the reason why you're gonna take that approach?
Correct.
Okay. Legitimizing the residents' concerns may be helpful. You want to make them feel like their concerns may be legitimate. Is that why you would take this approach?
I would say scratch.
Helping residents start new relationships is important. Is that why you're taking that approach?
I would say scratch.
And what about D? Sharing leadership. Oh, go ahead.
She's deciding to co-host the meeting. So that's sharing leadership with the social worker.
So anybody disagree with this answer?
No.
All right, very good. You called it co-host and sharing leadership. Very effective. So yes, that is the answer. Any questions about that one? No, that's a good old macro program development question. Just know, the ins and outs of when you're trying to establish a program, the proper protocol. You always want to include the people. The number one thing, you always want to include the people that's going to be affected. So if you're trying to start a program in a community, make sure you get the community's opinion. If you're trying to start a new program at your job, make sure you get your agency's opinions. Let them have some say so. The people that's going to be affected. If you're trying to start a program for teen mothers, make sure you get the opinions and discussions and let them share their ideas to teen mamas, because they're the ones that's going to benefit or be affected by whatever your program. That is the number one rule in program development, y'all. So whenever they're asking y'all in this exam about program development, which they will, the number one thing they want to make sure that you know is how to be inclusive of whoever's going to benefit from or be impacted by this program. They have to be included because their decisions matter. Okay. All right, we almost there, y'all. We're almost there. How y'all feeling? Is everyone feeling okay?
Yes.
Yes.
All right, so I'm gonna take this one because it's a long one. And I normally don't do long ones, but I kind of like this one, so I'm gonna read it. Okay, here we go. A social worker is meeting with a recently divorced man, and for assistance, wait, see, that's on me, y'all. It's supposed to be 4. A social worker is meeting with a recently divorced man for assistance with his 9-year-old son. The man was granted sole custody of the boy because his ex-wife, emotionally abused and neglected him. He reports that his son has severe temper tantrums lately and seems disoriented most of the time. He recently stabbed himself in the leg with scissors so deeply that he needed stitches. The man also reports that he lost his job due to missing a lot of work because of the boy's behavior and is uncertain of how he will care for him and his son if he doesn't find another job soon. A whole lot. During the initial interview, the social worker observes that the boy is withdrawn and doesn't respond to questions. What should the social worker do first? All right, that's a whole lot. And I like this question because I want you to be able to go to know that you know how to go in here and get what you need and get out. Don't be intimidated by all these words, even though you probably may have one question on the exam that might be responding, maybe not. So it says a social worker is meeting. So that means we're in the beginning. Okay, that also tells me during the initial interview. So I'm very clear now that we are in the beginning. So that means I am engaging, trying to engage and or assess this boy. Okay, so the social worker observes that the boy is withdrawn and doesn't respond to questions. That's what's happening right here, right now. Okay, so all this other stuff has already happened. I want to point that out to y'all. So he reports that his son has had severe temper tantrums lately or whatever. So we want to consider all of that, but we want to focus on what's happening right now. So he recently stabbed himself. That already happened, already, you know? So we're not focusing on that, but we are going to consider that, okay? He also reported that he lost his job. He didn't lose his job in the session, so we want to consider that, but that's not happening right now. That didn't already happen before he got here. So, but during the initial interview, what is happening is the social worker observes that the boy is withdrawn and doesn't respond. That's our priority issue, so we need to do something about that. What's the most important thing that we're going to do about this boy who is withdrawn and not responding? Are we going to gather information about the boy's mother to find out if she can provide any help at this time? Is that going to address the fact that he's withdrawn and doesn't respond to questions?
Correct.
Correct.
Discuss possible resources for the man and his son. Is that going to address the fact that the social worker observes him and he's withdrawn and doesn't respond to questions?
Correct.
Are we going to prioritize working with the boy on coping skills to help deal with all the changes? Is that going to address the fact that he's withdrawn and doesn't respond to questions?
No.
I mean, we in the intake, we ain't gonna be working with him on coping skills in the intake. That's not what we do. We're just trying to gather information, right now. We're not trying to start helping him deal with his issues, right?
Right.
So we scratch that. So what we're gonna do is we're gonna complete a full biopsychosocial assessment on the boy due to his symptoms, because that's what we're paying attention to. He's withdrawn, he's not responding. So let me do a full biopsycho. Let me see what, get some bio history on him. Let me get some psych information on him. Let me see what his social history like, how he get along with people at school. Let me see, if he got cousins, if he got friends. Let me get all this information to give me more insight into him. Because again, that is why they're there. He's seeking assistance for the boy. Okay. So any questions about that one? What do y'all think about that one? I think y'all were pretty much, the answer pretty much jumped out. It was very clear what the answer was. I didn't want to give anybody opportunity to kind of get caught up in here. So that's why I pointed out, all of this stuff already happened. So make sure when you're picking an answer, because think about if you would have focused on everything that's going on in here, he lost his job, all this kind of stuff, you may be tempted to pick another answer. Maybe you think that, oh, well, he needs a job to take care of his son. That's the most important thing. You probably would pick B, but that already happened. So we're not focused on what happened. We're focused on what's happening right here, right now. Clear?
Yes.
All right. Anybody got any questions? Any questions in the comments? I want to know what y'all thinking. Miss Yolanda, how you feeling?
I'm getting there.
You getting there? Okay, I need you to look. I need to boost that confidence up.
Yes.
All right. What about you, Rochelle? How are you feeling?
I'm feeling, I mean, I know I have, you know, of course, room for improvement, but I think that the way that you're explaining things is helping me a lot for sure.
Okay. And Miss Bridget, how about you?
Same. I'm just gonna continue doing practice questions, but I am learning a lot.
Good, good, good. And Miss Naomi, I know she's on mute. If you want to type something in the chat, just any questions you have, or just how you feeling after the
Yes,
session.
I can
go
hear you guys. Yes, it was helpful. The questions are always tricky for me, but it was helpful like when you break it down. I think I just overthink too much,
We all
when it
do.
comes to these
Yeah.
questions,
Me
right?
too.